Hi, my name is Zoila Reyna. I am your public health career coach, helping you get hired in public health. And for the last 3.5 years, I have helped over 200 of our colleagues, students, recent graduates, and working professionals to get a job in public health in industries ranging from nonprofits, government, philanthropy, hospital health plan, foundations, research, and so much more. I am so excited to share with you in this lesson of salary negotiation for public health careers, how to really make sure that you are maximizing your salary with your degree, whether it is a bachelor's, master's, or doctorate in public health. So the information I'm about to share with you is overall lessons. I have helped individuals get jobs ranging from $45,000, $75,000, $90,000, $125,000, and everything in between. So I'm sharing with you not only what a comprehensive package will look like if it is a salary offer. There's a few factors to consider for that, but also what are the 5 factors that really help you estimate a proper salary. So that way you take control of your salary, of your income. And I truly believe that you can build wealth in public health if you really position yourself and study the job market in a way that really maximizes your potential and really pays you what you are worth. So first and foremost, what you will run into is salary preference compared to salary negotiation. This is something that I touch on our social media to try to warn you that your salary preference, when you're asked either in your job submissions or by a recruiter before they invite you for an interview, is simply to screen you. This is a screening mechanism. This does not affect your actual final offer. So please be mindful that when you are inputting a number for salary preference for applications before you interview, or even during an interview, if they're just doing a gut check to see if the potential final candidates are okay with the budgeted salary, make sure that you choose a safe number. You can also choose a safe range. What I mean by that is after you've done your research on Public Health Hired's platform and from the job market and the postings that you've seen for similar roles, make sure that you pick something in the mid-range or even in the lower range, just so that you can get through the screening process. Again, this is just so that you can get a seat at the table so that they could even consider you for the role. So unfortunately, some of you get really excited and overshoot or are a little too aggressive when they ask for that salary preference, and you accidentally weed yourself out of the interview process. So again, just pick a safe number and just get to the interview. That's the goal. Now, this is not to be confused with salary negotiation, which really kicks in after your references have been completed, after your reference checks, after assignments are done, after the multiple rounds of interviews. So it is only when they actually call you or email you to tell you this is the role, this is a potential start date, this is the expected salary and the benefits that come with it. And you really just have to, gracefully say thank you for the offer. I'm really excited for the opportunity. I definitely want to review it in depth. Can you please email that information? The other principles we want to follow, from making sure that you know the difference from salary preference to salary negotiation, and also getting your offer in writing, to simply push as much as you can to get them to break and give you a number from something they budgeted. And with a couple times of pushing back, they tend to give. And if they don't, then you need to be ready with a range instead of one number, to actually be as specific as you can, because one of the psychological negotiation tips is to actually be specific in your request, because it signals to the other person that you've really thought about this thoroughly. Versus if you simply give a round number of 50 to 60,000, then that just makes it seem like you're shooting in the dark or you're just okay with about anything. Okay, so what are the 5 factors that you can master that I have also been using to help individuals with their salary negotiation and really educating our community on what to expect for public health careers and your income? So I am a firm believer. I am a firm believer in building wealth in public health, and I am so excited to share with you that one of the ways to do that is by looking and identifying some of these factors that will help you really position yourself for jobs that are going to pay you what you expect. So it basically starts from the beginning. Going back to honing, the H of hired is you need to hone in and weed out jobs that you know are not going to pay you what you expect. So one of the first factors, and one of the factors that is actually weighted the most, is the degree that is cited on the job as the highest preferred, required, desirable, or preferred. So what I mean by that is you must look for the degree they're asking for as the highest, because that tells you that there is a bandwidth they're willing to pay out. So on average, the degrees are worth if you only look at degree alone, if you look at this factor on its own. For those of you who have your bachelor's degree in public health or a related field, such as psychology, sociology, or anything in between, you're looking at $30,000 to $69,000 as your bandwidth. This is your pay scale. So this is where your entry-level jobs will be paying you and what you will be cited when you get a job offer, even if a job doesn't cite the salary. Again, your bandwidth, if you have a bachelor's degree, is $30,000 to $69,000. If you have your master's degree in public health or a related field, your bandwidth is actually $70,000 to $140,000. This, again, is entry mid-level jobs, and you can get paid beyond $140,000 if you keep going into the management track or specialization track. So again, this is if you have your master's and looking for that entry-level pay, starting at $70,000. I have heard individuals across the nation getting paid less than that, maybe $50,000, $55,000, $60,000. That happens. We'll talk a little bit more about why in the next few minutes, but it does have to do with location, state, and the industry that you're in. So we're looking at the 5 factors, right? The first one is just degree. So let's get through this. So if you have your master's, your bandwidth again is $70,000 to $140,000 on average nationwide. If you have your doctorate in public health or your DRPH, your PhD, or a related degree, you're looking at $65,000 to $180,000 as your bandwidth. The reason this starts a little bit lower is because jobs that require a PhD or entry-level PhD candidate, they actually cite these jobs as fellowships or postdocs. And so they actually start individuals a little lower, and then over the years in your career, you quickly can make up for that. So if you have your doctorate, don't give up, don't lose hope. If you feel like you're starting low, you can quickly go up the ranks if you learn how to hone into the skill set that really is of value in the marketplace that you have to offer. The second factor that really affects how job is quoted for salary is the title. What I mean by that is the one-word title. I'm looking at analyst, associate, coordinator, specialist, navigator, officer. That's what you're looking for. I'm not talking about all of the extra words that come with your title. So when I say the factor of title, you just need to identify the one word that really identifies your classification. You'll see a trend of what coordinators on average get paid, what analysts on average get paid, what associates on average get paid, what specialists on average get paid, and what officers on average get paid. These titles are very popular, very common, you will run across in public health, and so I wanted to provide you with what to expect when you run across them and how to read them. The other thing that comes with title is the exceptions that are thrown in when you introduce senior level, associate level, junior level, or levels 2, 3, 4. All of that changes the pay. So I want you to be mindful of that. When you're looking at title, yes, identify the classification, meaning is it associate, analyst, coordinator. But then the other exception is if it has a senior associated to it, or if it's added a level, then that actually bumps up your pay. I want you to please keep in mind the third factor has to do with the industry that this job is in. What I mean is, are you being hired by a nonprofit, a health plan hospital, a foundation, philanthropy, university research, or a private consulting group? All of that plays a factor. So I've been teaching you all the 3 industries that pay the lowest on average are government, nonprofits, and universities and research. In comparison to the 3 highest paying industries, hospital health plan, philanthropy foundation, and private consulting groups. So when you look at that, you want to make sure that, for example, an analyst working at a nonprofit who is being asked to have a bachelor's degree could be cited $45,000 as an example, versus someone who is also an analyst with a bachelor's degree at a foundation could be cited $55,000. That's what you're looking for, is the industry to slightly adjust, because you know that on average, this industry will pay me more than the other industries. So that is the third factor, is the industry itself that is being citing you the salary. The fourth factor is the state that this job is located in, or the location you will be where you will be located. So if the job wants you to work in some of the southern states, those states tend to pay on the lower end. So if you notice that a analyst role in, say, California is getting paid $60,000, you might find that same analyst role with the same type of industry cited $5,000 to $15,000 less in southern states like Georgia, Texas, Florida, even North Carolina, Alabama, Missouri, Mississippi, Louisiana, tend to cite on the lower end for pay. So these are things to keep in mind, because I recognize that at Public Health Hired, we celebrate stories of success for individuals getting jobs across the nation. So you might be seeing jobs getting paid out $20,000 more than what you're seeing in your state. So it's something to just keep in mind. This is why you see such different pay scales, especially when you factor in the state itself. So just keep that in mind. Here is a quick glance at states that are required to disclose salary. This is called salary transparency laws. So as we move forward, we're noticing states are adopting these kind of equitable workplace transparency laws that really promote more alignment to financial need. So please read up on the states that have transparency laws so you can be more upfront about you requesting that for a salary negotiation. That really can serve to your advantage. And lastly, the fifth factor that really plays a role in how much you will get paid is whether the role is supervisory or management. In other words, will you be expected to supervise other individuals, hire and train, and even conduct their performance review evaluations? So that means that, so if you are getting cited a job with management responsibilities that is not government, you can expect anywhere from $5,000 to $15,000 more compared to the counterpart who has no supervisory responsibilities. So how do you actually handle salary negotiation, or as we call it in Public Health Hired, salary adjustment requests? So the key to this is actually identifying the top 3 skill sets that they seek for this role. You should have already identified them from your interviews and from the actual application process, because you correctly identified those skill sets in your resume summary, throughout your cover letter, and throughout the discussions of your interview. So it is up to you to identify those top 3 skill sets. It can be anything ranging from project management, community engagement, strategic planning, stakeholder management, data analysis, surveillance experience, or anything that they really cited as their highest request. So what you simply do is you thank them for the initial offer, but upon further review, you would like to ask for a salary adjustment closer to X number. That X number needs to be a off number that is actually higher than what you really want. So if they gave you $55,000 as their initial offer, but you would be happy with $65,000, you need to actually request for $67,550, because that means that they will more likely meet you in the middle or come down a little bit closer to $65,000, or they will actually meet you at the $67,000 you requested. Sometimes that does happen. I have seen where companies come back and say, actually, we can match you. Sure, let's meet you at your salary adjustment request. Other times, yes, they'll meet you in the middle and they'll come down a little, which is why you want to ask for a number a little more than what you truly want. And then other times, they may simply just say, we cannot offer you that, so please let us know if you will accept the original offer. So when you use that number, you simply say, upon further review, I would like to ask for X amount given my expertise in skill set 1, skill set 2, skill set 3. So in your request, you actually have to say the 3 skill sets that they seek in that position. Now you want to do it in a way that's short and sweet. You're not rubbing it in their face. You're not using it against them. You're simply highlighting, after further review, I recognize this is really what you're looking for, and I think I deserve more. That's essentially what you're saying. But you're saying in a way that you're not begging, you're not groveling, you're simply stating facts. And when the hiring manager sees your request and sees the language that you're using, they will actually agree. They'll say, yeah, actually they do have those top 3 skill sets, and now we may actually have to consider this person's request. So that works to your advantage, okay? Now you can include other things in your email, saying that you also want to request a different start date, or you want to have further insight into the benefits before you ask more questions. So you can still raise all of that, but it is very important that when you cite your salary adjustment to the new number, you include those 3 skill sets that that they value the most. This has repeatedly helped my mentees in their salary negotiation, and they walk away very happy at the end. The other thing I want you to be aware of is the only times I have heard a job be retracted or taken away during the salary negotiation phase is 2 reasons. Number 1, the organization is amok and they actually need to pause hiring, and they regret having to put the posting out there because internally they were not ready to actually onboard anyone, and there's just too much going on internally. So yeah, sometimes that happens. Sometimes the company realizes, actually we're running up a lot of internal challenges. If this person starts, it's not going to look good. So they may do that. I have seen it happen. It's very rare. The other time I've seen a job be retracted, a job offer retracted, is when that individual attaches a document of another similar title within a company, or any association they try to make with another title or a chapter of that organization. That is when the job is retracted. Because if you try to strong arm a company in giving you more money because there's another job that cites another salary, then that's where you've lost them. So please refrain from attaching anything to your adjustment request, because it's only going to hurt you and it's going to put you at risk of losing that job. So how do these 5 factors kind of work together? Something that I find is that there's no perfect way to do this. One way to think of these 5 factors is to think of each of them as a lever on a sound mixer where you might move one and it kind of moves the others along with it. Or you can move one and the others may not be affected. I want you to simply consider what I've shared with you about the industries that pay more versus those that pay less, which titles have a stronger pay versus those that do not, the degree that you have and what pay scale you should expect within that degree. So all of these factors will play a role so that you can really see what this means for you to be negotiating. Now, I wanted to show you in real time some examples of these 5 factors and why you see the numbers that you see cited. In this next slide, you'll see a few roles that really highlight these 5 factors and what I mean. So I will explain to you why these jobs are cited the way you see them because of the 5 factors I just raised to you. So for example, here we have a senior coordinator role in Texas, and it's being cited $44,000 to $75,000. Now, mind you, it is asking for some college. It doesn't say master's. It doesn't say doctorate. It doesn't even say bachelor's. It says some. Okay, so keep that in mind. But it also does want a few years of experience, and that is separate from what I'm about to share with you. But the point is, notice that the coordinator title falls within what we expect. It tends to be on the lower end. Coordinators do get cited around $45,000, $55,000. Notice there's the senior attached to it. So the pay scale is now adjusted to that, meaning someone could argue that they deserve to be on the higher pay scale above that $70,000. But notice it's also in Texas, so it's going to give you that bandwidth to keep you low because they're likely to start you in the middle or start you on the lower end because it's just from the nature of it. And also it is government, it is county government. And so they are going to play hardball. And again, I hear government starts you in the middle or in the low range. So that's what you can expect, is that this person might get cited $45,000 or $59,000 at the most. But to make your case to get paid at the $75,000 rate would be someone who is actually master's level and can have that the 3 years experience they're asking for. But again, they don't have to give someone who has a master's level because all they want is someone with some college. So your competition is an individual who has an associate's degree, a bachelor's degree. So then you can make obviously over $100,000 in public health. What you really need to hone into actually has a lot to do with the skill sets that help a company make change. So what I mean by that is you need to really get comfortable in identifying key terms that align to the value of a company for change management, strategic planning, revenue generation, donor development, partnership development, communications, and even policy advancement. So please keep in mind that companies actually reward the highest to individuals that either rake in the money, bring in the money, or help a company improve and make change and evolve, whether internally or externally. So for those of you who are frustrated and you feel like you're stuck at jobs either $65,000, $85,000, or even you're close to the $100,000, but you don't know why you can't break through past that, it has to do with you not being aware that the jobs you need to search from the beginning with the key terms that really will hone into those 6-figure jobs, again, has to do with the key terms that align to helping a company make change. So again, change management, strategic planning, process improvement, quality improvement, all of this will really make a difference in how you find them and the times that you get cited for higher salary. So what's exciting is a lot of times these jobs that actually pay 6 figures will not say how much they pay because they want the candidate to read and identify themselves and know that they align to that job and know their worth. And it starts from the beginning honing into the right job with that expectation that it will give you a $100,000 job. So please stop being frustrated if you are applying to jobs like coordinator titles, program manager, project manager titles, and you think that you should be getting $100,000. That's not going to happen. It's just not the reality of the job market. Not with anything that I've been showing you is that going to happen. So please study the job market, study the titles that align to your degree with your experience, study the job so that when you apply, you know that they're going to entertain your salary request, and also that you actually look for jobs that really align to more of the skill set to advance and change if you really want to make $100,000 or more. So with all that said, I hope this salary negotiation for public health jobs has really inspired you to take control and really advance in your career. I'm so excited to hear about all of your job offers and where you end up in your career. Please keep sharing with me your job offers, your pay, your titles, how you're enjoying your job, how you're finding your jobs, because it really informs the rest of the community on how to continue to advance in this field and build wealth in public health.